Almost 1 in every 2 general practitioners working in rural Australia is overseas trained. And while they're filling an important gap, the same cannot be said for other health professions such as physiotherapy, psychology, pharmacy and even nursing. That's why exposing the mostly city-born and bred medical and allied professional students to what life in the bush is all about is crucial to coming up with lasting solutions to the rural health crisis. Sean Murphy reports on a unique weekend event which has already influenced more than 400 students.
They're mustering at Oakfield near Dunedoo in the central west of New South Wales. But this exercise is more about rounding up a new generation of medical professionals to work in rural and remote communities.
So the brown ones, does anyone know any cattle breeds? No one. The brown ones are a Hereford, and these are Poll Herefords. The black ones are Angus.
Shannon Knott grew up helping run the family's 1,300-hectare mixed farm. Now he's studying medicine and is a driving force behind the Rural Appreciation Weekend.
For the students, it's about them being able to come out and experience a new setting in terms of being able to come out into rural Australia and a rural community out here in Dunedoo. And for them, it's to get that hands-on experience and break down the stereotypes and stigmas, many of them attached with working in rural areas. These students have come from various locations across the country. There's 15 universities represented here, and we've got students as far as Darwin. Most of them have come from Sydney, but also we've got some from Tassie as well.
Behind the cute lambs and laughter, this is a serious mission.
Number of doctors have deteriorated, services have been cut down in rural New South Wales and across Australia. It's a huge problem. Workforce has diminished. 50% nearly 50% of rural workforce is filled in by overseas trained doctors now.
I think this is the key, the focus on our domestic graduates, our university graduates. How do we encourage them to actually consider a rural career? And not even for a lifetime, but even for 2 years, for 5 years, just to try it. This is the real challenge of our times.
So the less stress on the animal, the better. So this fella here, if I send him round the back there, go back.
The Rural Appreciation Weekend is about exposing mostly born and bred city kids to aspects of country life.
He is your record holder when it comes to pumping out a massive amount of venom. Now
Learning about snakes and how to treat their bites.
From the start at the fingertips and toes of the affected limb, we're working our way up. Now we're wrapping that bandage as firmly as you would say for a sprained ankle or for a sprained wrist.
Dancing like a kangaroo, or watching a muster on horseback. Steve Knott has now hosted 4 of the weekends and says they're about mixing fun with an authentic experience.
I'm overwhelmed with the students that come here. They're so nice and well behaved. They get a lot of experience through into the rural area.
And the buzz is shared by a host of volunteers, including local stockman Mick Smith.
The look on their faces when they see some of the things that we do up here. You know, from handling the stock to shearing the sheep. A lot of those kids have never seen that sort of thing, and if we can sort of open their eyes a little bit, give them a bit of an idea what goes on up here, well, maybe we can get some doctors up here in the bush.
The weekend is about more than attracting new doctors to the bush. It's about drafting a whole range of medical professionals and ultimately improving health outcomes.
Good boy, come back.
The federal government has a number of incentives for GPs to relocate, up to $120,000 for relocation, and then up to about $40,000 each year you stay there. Now that's great for GPs, but we actually need to make sure we have podiatrists and nurses and psychologists, everybody in rural and remote Australia. And I think that's where we're starting to get to now, realising it's not just about GPs, and they're starting to put on more incentives for other health professionals, which is sorely needed.
Ring on the tail.
We need interprofessional teams. So that means expanding some of the incentives that are given to doctors, to nurses and at-need health professions out here in the bush, such as physiotherapy, pharmacy, your social workers, psychology, mental health workers. We need to have all of them working together synergistically and supporting each other to avoid things like burnout, which we hear about in the bush, and improving patient outcomes.
Really hurt.
Shannon Knott is now in his 4th year of studying medicine. He reckons getting hands-on practical experience early in a student's degree would help attract more graduates to the bush.
We need to set a national standard for all universities to teach students not only the theoretical knowledge at an early stage, but also get them out here. They don't necessarily need to do placements because at that early stage in their degree they're not skilled enough to do placements. But what we need to do is be able to get them out and hearing from rural health professionals who are passionate about their jobs, and also being great role models for the students in terms of allowing them to know where career pathways can go in the bush.
The really good thing about working in these areas is you can create your own life here.
Role models such as German-trained Peter Brendt, a staff specialist and anaesthetist with the Royal Flying Doctor based in Dubbo.
My daily working life is something which I have created for myself. I work as an anaesthetist in Dubbo Base Hospital a few days. I work at the School of Rural Health teaching junior doctors and students, and I do emergency retrieval work with the RFDS. So if I work with the RFDS, I go out to remote places and rescue lives. That's fun.
This year's Rural Appreciation Weekend coincided with Dunedoo's Centenary of Rail celebration, and it was an opportunity for the students to get a sense of community life in a small town, something that can't be taught at university.
What they don't learn is the sense of community, the sense of lifestyle, the social outcomes that you can gain from working in the bush. So for us, it's about breaking down the fact that these students, many of them will think, oh, if I go to the bush, I'm going to be completely isolated, I'm in the middle of nowhere, there's not going to be a social life. We need to get them out of that mindset and let them know that out here in the bush you can have a great time and you can have a brilliant job as well.
Got a bit of a flu and that in my throat.
Dr Tilak Dissanayake is a general practitioner at Coolah in New South Wales and is a member of the Rural Doctors Association. He was working as a vascular registrar in Melbourne a decade ago when he accepted a short-term locum here, fell in love with the place and never left.
Do you find it difficult to breathe?
It depends on what you want to do with your life. I mean, I'm into farming. Of course, I've got a farm near Galgong that I adore doing that, and that's a special extra things that I'm really endeavoured to enjoy. It depends on what you want. I think generally patients are very nice and they appreciate you, and you can, if you're community-minded, you can be involved with the communities and they welcome you very well and sort of relaxed lifestyle.
Daniel said one of the brown ones had a go at him yesterday.
A weekend away is a far cry from a life in the bush, but some of the students say they're now more open to the idea.
Okay?
And would you be interested in working in the bush?
Yeah, I definitely would be.
Certainly for a period of time. I guess I am a city boy at heart, but I love the bush. And look, there's always need for doctors out here, whether it be for short periods of time, and they're hectically overworked out here and constantly need people to come and give them a break. And so I definitely, after seeing the way they work, definitely consider that kind of work.
I think this is something sort of get me started to have some exposure to this part of Australia, and also what's it like to work here and to see just the everyday life.
And while the Rural Appreciation Weekend is a good start, Shannon Knott reckons the way to really get things moving is to have more non-metropolitan universities offering medical degrees.
If you think most of our medical schools, apart from Armidale and Townsville in Australia, most of them are based in big metropolitan hubs. So a rural student like myself, for me to study medicine, I have to go to a big metropolitan area. I have to go there, and what happens is it will see students, they start to establish links in the city, partners in the city, and it's pretty difficult once you get yourself grounded in an area to pick up and move. So absolutely, regional universities will see more students go into the bush when they graduate.